Well, a wonderful good morning to you, Grenada, Carrick, Repeating Mountain, the rest of the Eastern Caribbean, to you wherever you are. It is Wednesday. It's the 23rd day of the month of February. Indeed, we can safely say there's 2 down and there's 10 more to go. Who would have possibly imagined we'd have been having this conversation and being at this time of the year, at this point where we are in February. This is a pleasure being here at you. I'm Joseph Cadore, and thanks and welcome to another episode of To The Point. My guest this morning is the Minister of Health, Minister Nicholas Steele. And certainly let me say thanks and welcome to all of our listeners on Classic 105.5 and 105.9. Those of you that's on the FM band. And we say a wonderful good morning to our listeners and our viewers. Those of you joining us via the World Wide Web at www.gbn.gd, or you probably via our social media platform, Facebook, YouTube. Remind you that the number in studio that you can engage us on is 435-2041. And you can also send us your questions, comments, or whatever submissions to via our WhatsApp portal, 435-2041. Again, thank you and good morning to you. And let me say a special and warm welcome to the Minister of Health. Good morning, Minister Steele. How are you?
Good morning, and good morning to all of your viewers and listeners out there. Beautiful morning again in Grenada.
It is beautiful. It's been the last couple of days, actually. It's been nice weather, where you almost feel like not wanting to do anything, and then your better judgment kicks in. You're like, nah, you got to do something. Because the day you stop doing something, that's when it all comes to an end. Well, let's start the conversation, Minister, and probably the rightful place to start. An update. Where are we? COVID-19. What's the status quo? We've been hearing a lot of announcements. Carnival in Carrico, different things. We hear the Ministry of Sports getting excited, and sports officials and organizations about returning or getting into what we did agree was going to be the new normal as it is. What's happening though from the ministry's end?
Yes, indeed, it's we're in a good place. We are comfortable where we are. There are certain shortfalls. There's no such thing as a perfect position to have. But I think with the guidance and leadership and cooperation, most importantly, the cooperation and sacrifice of the Grenadian people, we are where we are today, which is where we can look at and contemplate the easing of many of those restrictions, and as we move forward with expectation that we can ease or remove almost all of them. What are the variables that we're not in control of? Should this virus mutate into something else? But right now, we're not seeing that based on all indications and all of our communication and discussions with our colleagues at WHO. That for the time being, there is no possibility or there's no acknowledgement of that happening, and that we should look at using this opportunity to get back to some sense of normality as quickly as possible, while being as prudent and cautious as possible.
Interesting that you said that. You made mention to the WHO. I was reading an article. I just popped in my head, remember it, a couple of days ago, and it was quite interesting. It made reference to I can't remember exactly how it was dubbed, but it was in India actually that health officials were concerned about symptoms that mimicked the Omicron variant and the Delta variant, and they were trying to look at it, and they were concerned as to exactly what it potentially meant. Is that a conversation you've heard through your sources?
Well, we have been in communication, constant communication with WHO. This week, again, we meet and we discuss, and they pass on information. What we are looking for would be new variants of concern,
right?
If at all. For a variant to show up now, it has to be one of two things: either more contagious than Omicron. For us to notice it, for us to even be present, or more deadly than Omicron or Delta. And those are the main things that we're looking for. And to date, we do not have that, and that's why we are proceeding with caution, but proceeding the way we are.
On the ground, what's happening on the ground in reality? Yeah, I know the numbers are going down, and I know your officials from your office continue to monitor the proceedings locally.
Yes, we do. Information is still shared daily with respect to the various benchmarks that we look at, which are number of new cases, number of tests done, but most importantly, number of hospitalizations, or regrettably, the level of that hospitalization. You have incidental hospitalization and you have hospitalization due to COVID-19. So in other words, because COVID-19 is out there in our community, there is a possibility that somebody admitted to hospital for a motor vehicle accident or something else happens to test positive, but they're not admitted to hospital because of COVID. And then also what you want to measure are those who are being admitted because of COVID-19. And that's what from the beginning we strive to keep at a minimum. And that is what has caused, in most instances, the various restrictions, etc., so that we don't inundate our health system, have the health system collapse or so.
We want to talk about the way forward, but if we can, I think it would be remiss of all of us if we don't assume reasonably that as a ministry, you've looked at the last 2 years and you've evaluated, you've done your analysis, that God forbid we find ourselves in a similar position or any position that of a pandemic nature. What can you say that we've learned from the last 2 years? And certainly what can you say that the ministry will be looking to do as it relates to navigating and looking forward?
Well, Joe, when we first started this, there was no roadmap. There was no textbook. We have a roadmap now. We have a textbook. We have a best practice list of procedures, etc. We have strengthened our health system. We have been able to survive the worst that COVID-19 has thrown at us. So we understand this disease much better now. From the level of treatment, from the response, from how it behaves itself, because literally this virus has a personality, and its personality has varied as its variants have come forward. But our team recognizes the personality of this virus, and also we recognize that a significant amount of the success has been the public psyche, the people of Grenada, and their acceptance, acknowledgement, and appreciation of the risks at any point in time.
Can we look forward to there being a blueprint or a document, a strategy that speaks to dealing with pandemics, endemics, that at least 5 years from now, instead of having to reinvent the wheel, there's a protocol in place that comprehensively looks at, if ever we have to, this should be the first course of action, and we deal with it as we go along?
Yes, Joe, definitely. At the level of WHO, at the level of regional Pan American Health Organization, CARICOM, OECS, and here in the ministry in Grenada, there are procedures in place now, and what needs to be done. So you would see recently, last week, we received from the UK government thermal scanners. So there's certain things that still have to be done, although we are saying that the worst is past us with respect to COVID-19. There's still areas that need to be strengthened, reinforced, or you need to make sure that in certain areas you don't drop your guard now, that the worst is behind you. You still must remain diligent.
While you're on the issue of diligence, underscore for me, Minister, the importance of the relationship that Grenada serves with regional counterparts like PAHO, CAFRA, and those regional organizations in ensuring we maintain the sanctity. While challenged, we can be able to maintain the sanctity of our healthcare system.
But Grenada has various levels of responsibility and interaction. the first and most important part, I think, is IHR, international health regulations and reporting. We have an obligation to report any incidents of concern, regional concern, national concern, or international concern. So the COVID-19 cases, for example, or any other infectious disease that is on that list, the obligation to report any incidents of it immediately or in a timely fashion. There's that part. And once all other countries do their part with that, it keeps all of us in a better position. But then our medical personnel and our administrative personnel, remember that PAHO is the sum of its parts. It is made up of its members. Its members are the administrators. So too with WHO. So at this point in time, Grenada sits on the board of the WHO. We are one of the executive board members, not just a member of the WHO, but an executive board member of WHO. So we interact at the highest level, apart from just interacting as a member state for the time being. And we've been fortunate to have had that position for the last year and some. So during the most difficult times of this pandemic, we have from our nurses in our community all the way up to our minister. There is a mechanism of reporting and interacting, whether it is training, whether it is reinforcing of protocols, or just simply communicating the position on the ground, not just for COVID-19. But for non-communicable diseases as well, the level of diabetes, the level of high blood pressure that we have in our society, public health in general. So it is from us being able to report this, from us being able to take these reports, that we strengthen our region, our country, and internationally. So that is a responsibility, I think, and interaction that we have. We are part of, and we are obligated to those entities.
And we're assuming that we've learned a lot for the last 2 years and possibly seen greater collaboration, not just with the health instruments of the region, but different auxiliaries, CARICOM, the OECS, because we've spent the last 2 years in sharing information, linkages. I'm assuming that one of the takeaways from this is that a strengthening of these regional and sub-regional bodies?
Yes, most definitely. I mean, the region and the world is coming out stronger than it has ever been before, health-wise. It is for us to make sure that there's a legacy from this, and it's not just the time, effort, resources, funding, etc., that was put to healthcare or public health during the COVID pandemic, but a recognition of the importance of health moving forward and public health. As COVID-19 becomes something of the past, healthcare still remains the present and should be one of our key, most important agendas and priorities as any country, as any region. So yes, we are much stronger now because we as a people are much more sensitive to having a strong healthcare system.
We're keeping our eyes on the clock. 15 minutes gone past the hour in the morning time. For those of you just joining us, my guest this morning, Health Minister Nicholas Steele. And we're just about doing an analysis to look at the status quo where we are with COVID-19 and just highlighting the strengths and the way forward. As we look forward, Minister Steele, certainly I want us to spend the next few minutes talking about a conversation that has been in the pipeline, has been out there for quite a while. That is health insurance. You just highlighted the fact that ensuring the sanctity of who we are as a people, ensuring our healthcare system that it grows. But there's often been a conversation of the cost of getting good healthcare services and the need for us to be more proactive. And certainly health insurance has been one of those conversations that has been there, that some have argued has not received the adequate amount of attention that it should. What say you? And what's the way forward
Joe,
for it?
You're correct. There's been an acknowledgement from the WHO level all the way down, and individual countries as well. the healthcare have been ignored. And we'd be the first to admit it. Scarce resources, limited manpower, everything was thrown at COVID-19 to prevent being inundated by that storm. So during the passage of that storm, the other areas of healthcare and public health have been ignored. There was an acknowledgement, I think it was on your station, there was a program I was listening to a couple nights ago, which spoke to the area of cancer, diagnosis, treatment, preventative measures, messages, etc. In general, our non-communicable diseases. So that's why, as we put COVID-19 behind us, and as health officials, my team are extremely happy, elated to be able to say we're stepping away from COVID-19, because we're not going, we're stepping towards the other things that we need to and should be. So health insurance is most definitely one of those, because health insurance creates an awareness and speaks to healthcare in general. It's not just about making sure that your bills are covered should you need healthcare. It is about looking at a national level in terms of what that cost would be and how do we cater for that cost. Where does that money come from? It also looks at, well, if this is your national cost, how do we reduce it? How do we speak more about prevention rather than cures? And try and address certain issues before people come to health centers or hospitals or go to their doctors. So it speaks to public health. So national health insurance is a discussion, is a debate, is a demand and a need that causes us as a nation, not just as a ministry or a government, to address all of the issues of healthcare. And yes, during the pandemic, it has had to take a backseat to COVID-19. Now that we are past, it is most definitely back on the front burner, as are all of the other public health issues.
20 minutes gone past the hour. While we on the issue of healthcare, last week I had Dr. Bristol on with me, and it was all smiles. It was really and truly all smiles. And I know I say Dr. Bristol's, and I'm seeing the smiles exuding on your face as the government continues in efforts on expanding its renal capacity on island. What can you tell us? What can you update us on that?
It's indeed a proud moment. There are mixed emotions on it, but it's a proud moment that we are able to commission a dialysis treatment center. The team has worked very hard on this during the pandemic as well. While we were focusing on COVID-19, we were still able to keep some attention on this the dialysis unit. So it's in my opinion, it's a year late, but based on what we've had, the challenges we've had, I need to compliment the team for getting it done in this timely manner. Now, it's mixed emotions because just the recognition that there is such a need in our Spice Island for dialysis treatment speaks to the other side of us having to put as much attention on prevention, on ensuring that we begin to adjust our diets and lifestyles to prevent so many people getting onto dialysis. But it's a chicken and an egg sort of situation, and we need to make sure that all areas are covered. So while I am proud and of the achievements of the team in getting the dialysis center up, I will be the first to acknowledge that the journey is not over, the battle is not won. We now need to focus as much attention, if not more attention, on prevention while we have this dialysis center up.
Having indicated the need for taking a more preventative approach, proactive approach to healthcare, those who have argued that while, yes, COVID has had its own challenges, that it also provided us with a really great opportunity that we've missed out in terms of encouraging, even at a greater level, the need for us as a people to eat healthy, eat local, and taking care of ourselves. I think some have argued, listen, with COVID, people were like, we need to do this. But some have argued that our health officials sort of missed out on that opportunity. Is that a focal point for you? And can we see a greater trust from the Ministry of Health in encouraging folks and really seeing the need to listen, eat healthy, take care of yourself, put yourself in a better opportunity to live a long, sustained life?
Well, Joe, there is always a need to promote, to do better promotion of healthy lifestyles. My previous comment on dialysis acknowledges that. So healthy lifestyles or healthier lifestyles always needs to be promoted. And yes, at any opportunity, that should be done, or more of that should be done or could be done also. I do remember Dr. Francis Martin, from the beginning when he was with me at those press conferences speaking about diet. And other doctors and nurses who have been in the public fora have been speaking about that healthy diet and lifestyles, etc. That's always beneficial. What we do need to recognize, though, is that in the height of a pandemic, so in other words, when the storm is upon you, while it is an opportunity to speak to what could be done, should be done, and needs to be done for personal responsibility, or from a personal responsibility point of view, at that point, it's a bit late to be talking about getting yourself healthy, to prepare for the storm. The storm is upon you. And that is why you would have seen a lot of our time and effort would have been on the preventative measures in terms of social responsibilities and also vaccination. That is where we would have spent most of our efforts, because there was an immediacy. That does not mean that it wasn't equally important to acknowledge that those who had healthier practices, lifestyles, etc., and who took the necessary precautions way before COVID-19 existed, would have faced this storm in a better position than those of us, unfortunately, who did not. So when we speak to comorbidities, that persons with comorbidities had higher risks. In most cases, those comorbidities are non-communicable and as a result of lifestyle.
25 minutes gone past the hour. We have to take a quick commercial break, though. My guest this morning, Health Minister Nicholas Steele. We'll be right back after this quick commercial break. Right here in
Get ready for a season of grooving smooth and live on GBN. Grooving Smooth and Live is a 1-hour performance gig every Thursday from 8 p.m. featuring performances from our local musicians and short interviews discussing all things musical. Every Thursday, a different musician and a different instrument will be featured, from the violin to the saxophone to the trumpet, guitar, and steel pan. Our local musicians playing, improvising, and educating us on all genres of music. Join GBN with host musicians Matthias and Shireen, and a special guest every Thursday at 8 p.m. It's Grooving Smooth and Live on GBN.
Join GBN on Wednesday nights at 8 p.m. for Interesting Grenadians, a program that showcases the lives of interesting and outstanding Grenadians at home and abroad. It's Interesting Grenadians every Wednesday night at 8 p.m. on GBN. Don't you miss it.
Thank you. Welcome back to the program. 26 minutes gone past the hour. It's to the point for today, the 23rd day of the month of February. My guest this morning, Health Minister Nicholas Steele. The number in studio, 435-2041. And you can feel free to call in and pose your questions, or you can submit them via the WhatsApp portal, 435-2041. And certainly I would be engaging those that's on the different social media platforms, be it Facebook or YouTube. Indeed, It's a pleasure having you being part of the program this morning. We have our first caller that is on the line. Good morning, caller. You are
Yes,
live.
good morning. Greetings. Listen, Mr.
Good morning to
Cadore.
you, sir. Yes?
Can Mr. Steele hear me well?
Good morning, Citizen Rolo. I can hear you
Greetings.
loud and clear.
Thank you very much. A couple of things I'd like to talk. Listen, first of all, be careful with would have plus the past participle. It continues to slip out. That gives spurious information. Just a note in passing. Now, Mr. Steele, sir, you used a word a while ago, figuratively, the storm of COVID. Now that the storm of COVID, which indeed triggered a state of emergency 2 years ago, has subsided, can you tell us what justifies the quote-unquote status or state of emergency which still exists in the country? Let's go to the second one. Mr. Steele, we noted that over the past 2 years we've had 200 plus people dying deliberately from COVID, directly and indirectly with all the comorbidities and otherwise. Mr. Steele, there is a problem in this here country which we have lived with for many years. When we did not know. Today we know that air pollution, the respiration of contaminated air, kills 7.5 million people around the world annually. These figures can be confirmed, but I know the last time I saw them day before. The question of burning materials in the public spaces, Mr. Steele, in this here country is becoming overwhelmingly dangerous for the health of the people. I suffer a respiratory problem. I smell what you cannot smell. I have to put on an anti-gas mask in the night to try to sleep because charcoal kilns, otherwise known as coal pits, are kept alight. That's the only way you could burn, really, to stay night and day. But it affects my health. I wouldn't go on because you know the details and your medical practitioners can advise you on it. Mr. Steele, I would like to advise you in the interest of public health to begin, convene, whatever you care to call it, a discussion on air pollution in this country. People burn plastics, all chemical composites, including wood, construction rubble, agricultural stubble, sponge, nylon panties they burn, Mr. Steele, in this here country.
I can't hear Rolo.
Let us end here. I'd like to ask you, through your medical professionals, to begin a debate on this issue in a bid to modify the laws of this here country to stop, prohibit, ban immediately, as soon as possible, burning indiscriminately in public space.
Okay, thank you, sir.
Very much and have a nice day. Will you?
The best to you. So 2 questions there to you, Minister Steele. The first one regarding the current installation of the installment of the state of emergency. He wants to know why it is still on. And then basically looking at the issue of air pollution, indiscriminate burning, whether or not there are policies that can be in place or what exactly should govern and help to curb that issue, what he sees as an ever-increasing problem on island.
Yeah, Joe, the first question I did address yesterday too at Post Cabinet, so I'll just reiterate that yes, I firmly believe that the state of emergency will be removed very soon. I think just as a parliamentarian myself and one of the individuals who was actively involved in the putting in place of a state of emergency, I would just simply say my part and role in this is to make sure that when it's removed.
Right.
And it's not removed prematurely and possibly have to come back. But most definitely, I look forward as much as, if not more than others, to the removal of it. On the issue of the air pollution and the burning, I support Citizen Rolo 100%. There are laws, and as Minister of Health, there are individuals who are supposed to be there to enforce. And if, from what he is saying, if I can gather from what he is saying, that this continues habitually in his area, and that he has reported it to the health officials or to the police and nothing has been done, then we need to address that at a higher level, and in forums like this publicly. It takes sometimes a little bit more than just simply relying on the Ministry of Health or the police, and sometimes as a public citizen, and Citizen Rolo knows that very well, that he uses the public forum to embarrass the offenders. And to get them to stop, because there are laws against it. There are individuals here who are supposed to be the enforcers of that law, and they are out there. So if he has reported it to them and they have not done what they're supposed to do, then yes, he has a problem, I have a problem, and we can collectively address it using the public pulpit as well.
Another caller on the line. Good morning, caller. You're live.
Good morning. Thank you.
Good morning.
And as a matter of fact, just to add to what the first caller was saying about the indiscriminate burning, I think we also need to note at this time of year, it is just about the driest period of the year that we have. And it can be noted in the south, for example, southern tip of the island, I don't think there's a hotter, drier part of mainland Grenada that we have. And yet still, we do have that indiscriminate burning. Are there set standards, procedures for residents who are bothered by neighbors burning and everything that they can perhaps take into or put into action themselves? Sometimes it takes a while for, let's say, the police to respond, and I won't go into any reasons or anything like that. But especially when it could be a fire hazard as well as a health hazard, and especially very close to the airport. Your comments, please. Thank you.
Joe, that's a very familiar voice, and good morning to that very familiar voice. I just want to say that the call is correct. That there are two ways. There are laws that prohibit the burning of refuge and bush, as we say. That it's not allowed except under specific cases where permission is sought. So as neighbors, we need to find neighborly ways to request or inform our neighbors that what they're doing is incorrect, and is creating a fire hazard possibly, as well as a health risk to us. And as neighbors, we need to appreciate, if we are the ones doing it, that we are affecting not just ourselves, but our whole village in some instances, if it's a coal pit or so, and that better ways need to be found to do things, and we cannot, no one can be engaged in a process that is putting the health of those around them at risk. And that's a lesson we know for sure from COVID-19 and before that. While we have freedoms here in Grenada, the exercising of our freedoms are not to put others at risk.
And I think you could probably say it's interesting that only a couple of weeks ago, I had representatives from the fire department of the Royal Grenada Police Force who was on this very platform, and we went through the laws, exactly the rules and the restrictions regarding indiscriminate burning. But I think you would agree, Minister Steele, that it's a conversation that needs to continue, and maybe we need to be a revamping of that healthcare protocols as conversation that maybe we have to take back to the schools so that another generation understands the challenge that we pose to ourselves and others by such practices.
Joe, I agree 100%, and I see one of your viewers on social media has also said that maybe we should use social media as well. Take pictures of the offenders and post it, so that we know that we will be embarrassed by our neighbors, by our fellow citizens whose health we are jeopardizing, and I think that is their right to do so.
Name them and shame them. And I can easily see the argument that's going to be brought into focus. This is where living and livelihood probably converges. Folks to say, listen, I've been burning coals all my life. That's how I make a livelihood. But certainly it's a pretty reasonable argument. But it's a conversation that we definitely need to go in depth to, because our population is increasing. Where it was okay to have a coal pit years ago, it may not be the appropriate place within our current construct of how our society has evolved. 23 minutes gone past the hour in the morning time. Mr. Steele, we were talking about COVID, and I wanted to touch with, because time it runs so quickly. There's an article that I shared with you, and I want us to have a bit of a conversation on it, out of one of the international mediums, that of multi-system inflammatory syndrome, and health officials in the Western world, greater Western world, they've raised concerns as to the possible impact it's having on children. It leads rise to inflammation in the joints and so on. And there are concerns, while it is yet early, but they're thinking that that's one of the possible spin-offs that can be triggered from COVID. Is that a conversation that's happening on the ground here?
It's a conversation, and it is something that we're monitoring. But let's deal with the facts of it. There have been certain levels of cases that have been noticed. But when you look at the overall, for instance, in the United States, that's where most of the reports have come from. The U.S. has had, throughout this pandemic, 12 million children in that age group who have tested positive to date. Of those 12 million, 0.005% have shown multi-inflammation syndrome, MIS, from COVID or COVID-related. And even then, the link is not solid in that, is it definitely from COVID or a coincidence that they are COVID positive as well. So it is still a bit early, and the numbers are still what is not alarming, 0.005%. But if you take 0.005% of 12 million and don't say, and just simply say 5,000 kids have had it. So from a Grenadian standpoint, if every single child, God forbid, in Grenada was infected by COVID-19 or with COVID-19, we'd expect to see about 15 cases of that. So we're always concerned. One case would be one case too many, but we are not seeing it, and as yet, it is yet to be determined a link. It is part of discussions always with WHO and PAHO in terms of what any country and the responsibility of every country to report any incidents of concern. But we are not seeing it as something to be concerned of here or to use it as a reason not to have our kids back in school. It is always any of the side effects, no matter how rare or so, are reasons why we say that this is why we need to be vaccinated. This is why we need to make sure that none of these long-term effects, possible long-term effects or so from COVID-19 appear. And we need to take as many preventative steps as possible going forward.
While you want to issue of vaccination, as we talked about, the multi-system inflammatory syndrome, one can't help but notice, Minister Steele, that we have just over 30,000 or so Grenadians that have taken their 2 doses of the vaccine. And But of that 30%, thereabout, it's just about probably 20% of that amount that has gotten the 2 doses that have actually taken their booster.
Right.
Is there any concern? Because while yes, there is a call to the person should come forward and get vaccinated, we're also noticing that even those who are vaccinated, that there is a slow uptake in the administration of the booster. From a health perspective,
it bothers us. It is one of the issues that has to be taken into consideration when we consider the opening up and the complete removal of restrictions. That we are still very much an exposed nation, because we are still very much a nation that has not achieved an acceptable level of vaccination. When we see other nations, we've got to compare ourselves equally. So the UK has removed most, if not all, of its COVID-19 restrictions for its citizens within or persons within the UK, including the mask mandate. But look at the percentage of vaccination that the UK has. So it's a lot easier for their health officials and their government to make that decision. We need to make those decisions and need to contemplate that. But yes, Joe, you are right. Our low level of vaccination is one of the reasons that will cause and continues to cause concern and therefore possible slow or delay in the easement of our restrictions. And it's a policy or it's a science, a principle that we've been following. Look at the areas that we have opened first and allowed a freer movement and less restrictions are the areas that could have enforced or guaranteed that individuals there are all fully vaccinated.
But why do you think, though, Minister Steele, that while we agree, yes, there's been a hesitancy by a greater percentage, but why do you think that for those who saw the need to have taken the first 2 doses, even within that niche group, the hesitancy seems quite high as well to have that 3rd dose administered? So there is the 70% who has not taken any vaccine at all, but there is within that group, there still seem to be that hesitancy among that group as well to take the booster. Why so, though?
Well, there are 2 parts to that. One is that our biggest drive in vaccinations occurred in September and October. And those persons are not yet due for their booster. That has to be taken into consideration, 1. Okay. And 2, part of our drive was the mandate put on the hospitality sector as well. And there is no mandate for booster. Okay. So those are the 2 aspects. So it's not just simply, I wouldn't call it hesitancy to get a booster. And the majority of people who got their 2 doses, or a significant number, are not yet due to get a booster. And also, mandates made a big difference in the surge.
Okay. Let's go to the telephone lines. Good morning, caller. You're live.
Hello, good morning, and how are you?
Wonderful, sir.
All right.
Go ahead, please.
Steele. Mr. Steele, please, I'd like you to answer this question for me. With this word COVID and this system that all you have there, tell me where COVID really spring from. Right, because all you have name for it. Secondly, if you have something in place, the right thing in place, you would not have in this problem, because remember, look at the state of the hospital. Right now, the hospital in a situation years now, but it became an excuse for COVID. You go to the hospital, you can't get medication for no kind of treatment you go for. You can't get the treatment. You go there and do surgery, you can't get the right treatment. Everything is thing, and then now everything fall on COVID. So I want you to tell me where the COVID spring from and why the downfall of the hospital is all no one get COVID getting the blame for it. It's not yesterday, not the day before, because people used to be in the hospital and still have to go outside and buy medication. The hospital going lapidated, and nobody do things. What is the health plan of Grenada? It's rather ridiculous to the rest of the world. But because of COVID now, you use it as an excuse. So I want you to tell me where COVID springs from and what is the meaning of COVID. Thank you. I want you to tell me that, please. Thank you.
Thank you very much, caller.
Let me start politely by saying that it's well known where COVID came from, where the first cases of COVID-19 appeared, and that it's assumed to be a virus that existed in animals that mutated and crossed over to humans. But on the other side, and I'm not going to be try at all to be polite or diplomatic or so, I am tired of, and I think it is time that we acknowledge that our health system survived COVID-19. COVID-19 is not an excuse that we use for a health system. We proudly say, men and women of the general hospital, of all of our community health centers, all of our public health officials are stronger than they've ever been. And it is from their leadership that we survived this COVID-19. So most definitely, let me correct that caller immediately. COVID-19 is not an excuse. COVID-19 is something that we say proudly those men and women have stood up to better than or equal to many, if not all, nations in the world. Grenada's health system did not falter. It was stressed like all others, but the men of the general hospital, of all of our health centers, our nurses, our doctors, our volunteers, our orderlies, our security officers, etc., they stood up. And I think it is time that individuals like that caller recognize that healthcare is no longer a punching bag. This government has made sure of that. It is no longer a punching bag that you can just simply say that you have to. The little thing that the caller had to pull on is that you have to get medication. You can't get all the medication at the hospital. You can get all the medication that the hospital has. It's there. The budgets are there. There are needs. There are certain times where there would be something else. Now remember, all the medication at the hospital, in most cases, if not all cases, are provided free of cost to the people of Grenada. There are instances where the hospital will ask an individual to go buy or pay for certain medication, and that's something we need to get accustomed to. Do not see it as a failure of the system when the hospital asks you to get medication from a private source. That's not a failure of the system. That is the system saying we do all that we can, but there are certain medications that you cannot just simply expect that this too shall be provided free of cost.
Thank you, Minister. 12 minutes on to the hour. There are two questions I want to throw at you to make sure that we get in. With the opening up as it is, can you talk about the requirements for entry into the country as we move into the post-pandemic period? And certainly, Minister, one that is literally a burden on the tips of fingers most persons' minds, the fact that there's carnival in Carriacou this weekend. There is carnival. There's carnivals in other parts of the region, and we've seen there is the anticipation that people will be moving from point A to point B, even on entry to the country. There is a concern as to whether or not what are the protocols in place to deal with any potential increases in numbers on either end. So the entry requirement, whether or not there's any laxing of those, and what are those requirements, and dealing with the large increases that's expected in Carriacou, and as we look for Grenada, our own carnival, and other festivities as we open up.
Yep. Joe, the entry requirements, and we keep easing and adjusting those. But right now, you need a negative test to enter Grenada, first and foremost. You can have a PCR test, not more than 3 days old, or an antigen test, rapid antigen test, not more than 24 hours or 1 day old. If you are a non-citizen or resident of Grenada, you also need to show proof that you are fully vaccinated to enter Grenada. If you are a Grenadian citizen, then you do not have to be fully vaccinated to enter, but when you arrive in Grenada, you will be required to spend 7 days in quarantine. So in essence, that is what the protocols are at present. The chief medical officer or the health official at the airport does have the discretion to request, should you exhibit symptoms or so, the test on arrival. But largely that is not being done. All individuals, once they come with the appropriate negative test result on arrival and verification of their vaccination status, are free to go.
Free to go.
That's for travel. With respect to the response, Joe had said earlier that we do have a roadmap now, and I think most people are very much aware because Grenada's response has not been unique from other islands. Timings have varied, and individual combination of results or measures have varied from country to country. But as citizens, we're all aware of what some of the possible actions can be. So us saying that and allowing the activities in Karakou, and I said yesterday and I'll say again today, we monitor. It's not a test. We are monitoring. That's why it's done Karakou first, and we see. We do not expect to see a surge in cases, but if we do, we do have the ability to react accordingly, and persons are very much aware of what those measures can be. One measure can be just a slowing of further easements. Another measure can be a sort of a pullback, depending on how drastic or so that might be. I do not look forward to or expect to have any pullback on measures. That's why we're being as cautious as possible, as deliberate as possible with this. And others are saying, well, why hasn't it happened like it is happening in other places or so? No, we are being very deliberate, and our situation in Grenada is unique to a situation in Barbados or Trinidad or St. Vincent or Dominica, etc. And so. And also, remember, what we all need to be aware of as the other variable there is our level of vaccination as well. We always need to acknowledge that.
Good morning, caller. You're live. Good morning, caller. Hello, caller. 435-2041, that is the number on the inside. Just about 8 minutes onto the hour in the morning time. So those of you looking to make, if you have to make a contribution, now is the time. Good morning, caller, you're live.
Yes, good morning. Good morning, gentlemen.
Good morning to you, sir.
I need to remind Mr. Steele, and he should know fully well, you get nothing free in the hospital without taxpayers' money. So he got to correct himself. Nothing free in the hospital, you pay for it. Because right now, at the moment, I'm paying tax right to my nose. Every right turn is tax I'm paying. Everything is double, everything is treble. So you got to get his facts right. Bye now.
Thank you, caller.
My facts are correct. In any government system, or national of health or providing health, there are procedures, medications, etc., that are not covered by the tax dollars. That is a general accepted principle. What we strive to do, like any other government that has a social health system, is to ensure that as many as possible procedures, medications, etc., are covered by the tax dollars. But there is no system that has all procedures, medicines, etc., covered by tax dollars.
We're keeping our eyes on the clock. 5 minutes on today. We're getting ready to wrap, Minister Steele. I want to just touch on the issue of herd immunity, but let me allow for us to take this caller. Good morning, caller.
Good morning, my brother.
Yes, good morning. Go ahead, please. Your question.
Yes, what I want to tell my brother, Minister, I was in hospital and I get good attendance at 2021. The hospital, what I get good attendance. That fella that say the hospital, so nothing. Minister Steele, those study people you hear, you are doing a wonderful and a blessed job, so keep it up. Okay? Love you. Bye-bye.
Thank you.
Thank you, Joel. I'll do a smile. I'm not sure how to get the smile out on the radio, but I'm smiling. And I understand that caller. It's not to me, but it is to the men and women who provide the services at our general hospital that I'll say to her, thank you.
The issue of herd immunity and how much of an in-depth conversation has it been, Minister Steele? Because we've noticed that, we're not noticing, there is the hesitancy to the vaccination uptake. But if you're looking at the figures, where we've had just over 14,000 confirmed COVID cases, have you taken that into consideration as it relates to the immunity conversation and those who have been vaccinated, which is just about in the region of about 40,000? So if we do the mathematics, we have just we can actually say we are about the halfway stage. But how much of an in-depth conversation has the conversation of herd immunity being brought into focus and given consideration as we look to reopen?
It is a significant point, Joe. Significant point. The point you're making about those who have been infected and therefore have some level of resistance cannot be ignored. Definitely. But what we do not know is that level of resistance. Many of your listeners out there will acknowledge that they know some people who have gotten COVID-19 more than once because some of these variants do allow that. We do know the level of resistance that a vaccinated person has, and that is why we can determine whether any particular variant has a certain breakthrough level or not, or will have a certain breakthrough level or not. And Omicron, we were able to predict the level of breakthrough that we would see of persons. But I still reiterate that if you look at the hospitalizations and the deaths, that's the biggest. I hear many people out there saying, well, so many vaccinated people got COVID-19 recently anyway, so what's the point of getting vaccinated? Please look at the hospitalizations. Look at the hospitalizations and the deaths. That's what we're trying to avoid. That's the main thing. That yes, you could get COVID-19 after being vaccinated, but speak to those who did. Let them speak, not me, but speak to them. And they will tell you that they had mild or much milder symptoms than are unvaccinated individuals. And we're just trying to remove the risk from as many of our citizens as possible that would be posed from COVID-19.
Thank you very much, Minister. 2 minutes on to the hour in the morning time. This is as far as we can take you on this morning's journey. And Minister Steve, we want to say thank you and really want to say not just to you, but I think you would be remiss to not acknowledge the fact the hardworking Grenadians, the nurses, the orderlies, the doctors who literally have gone over and above to ensure that we weather the storm and we'll continue to position ourselves to grow our healthcare system as we move forward. Again, thank you for being part of the program. I want to say thank you also to all our listeners and our viewers on board. Good morning to Cynthia B, Ernesto, Jose, everybody else. That is Yulina Alexander. I hope you did hear your response to your question. It was posed to the minister. You're a Grenadian, so you know what? Come with your negative PCR test and welcome home, my dear, and you'll be perfectly fine. Yes? To all the listeners, viewers, wherever you are, have yourself a really wonderful day. Continue to enjoy the rest of your Wednesday. Until then, so long, everybody. JC loves you. Have a great one.